Welcome to Cancer Watch, a life-changing platform powered by the Common Cancer Foundation in proud partnership with Archon and proudly sponsored by Plus TV Africa. Today we will be focusing on neck and head cancer, the silent killer, and how to fight back. Together we fight, together we win. I am Denise Ejo, the CEO of Common Cancer Foundation, and today's episode could be a conversation that saves a life, maybe even yours.
Hello everyone, my name is Dr. B. Olutunde Olusegun. I'm the co-anchor and the representative from ACON, and today we will turn our lens on a quiet but very deadly disease which is a threat to people globally. And we're talking about head and neck cancers, the silent killer. And most importantly today we're going to focus on how you can fight back.
This isn't just a show. It's a movement for awareness, survival, and hope. And so before we dive in, take a moment, share this broadcast, follow us, and subscribe to Common Cancer Foundation, Archon, and Plus TV Africa, because every share could lead someone to early detection and a second chance.
And it's my pleasure today to introduce the person that will be joining us, who is a leading voice in cancer care and a man whose works speaks volumes in the fight for life. It's our honor to have with us and to welcome Dr. Godwin Uwagba, who is a consultant, radiation and clinical oncologist and the head and neck unit at the NSIA Youth Cancer Center right there in Lagos, Idiaraba. He's not only a specialist, he's a game changer from treating complex cases to shaping the future of oncology. This man has been busy saving lives and focusing on head and neck cancers for a while, as well as the diverse other things that he has really been up to. Dr. Uwagba is with us here today.
Thank you very much, Dr. B. Thank you, Dr. Dennis, for inviting me. And I want to also say thank you to the management of the Plus TV. Thank you, everyone. I hope we'll have a wonderful time as we share in this head and neck cancer topic. Thank you.
Thank you, Dr. Uwagba. It's a pleasure to have you here on Cancer Watch. Thank you for being part of this vital conversation as we shine light on the most overlooked form of cancer one of the most overlooked in our environment. And so let's begin this conversation. Please don't forget, share, follow, and subscribe to the Common Cancer Foundation, Plus TV, and Archon. Question time. Sit back, relax, and let's enjoy this conversation.
Yes, thank you so much, Dennis. We're going to spend some time educating people. Dr. Wagba, I would just like to jump right in and ask you the question of why is head and neck cancer, why are they collectively referred to as the silent killer, especially in our environment? What's the issue here with your wide experience with managing head and neck cancers? What's the reason why? Dr. Wagba, please.
Okay, so thank you very much, Dr. B. Of course, you're also a doctor and also a renowned oncologist in Nigeria. First and foremost, before I answer that question in terms of trying to talk about why is it called a silent killer, first, I just want to also let us give a brief what is head and neck cancer, because sometimes we try to assume that people know what head and neck cancer is. So basically, head and neck cancer, just the way it's been stated, where you have cancers that arise within what we call the aerodigestive. What do we mean by aerodigestive? That is where air and food passes through. That means that you are talking about cancers around the head, around the neck. We are talking about cancer of the nose, cancer of the nasopharynx, just behind the nose, cancer in the mouth, everything in the mouth, around the mouth, cancer in the neck, around inside and outside the neck. That means we're talking about the vocal cords, the vocal box, what we call the vocal box, that's the laryngeal. Then we have the cancer. So from anything around, from the nose, inside, to the ear, to the mouth, inside the throat, that is esophagus, larynx. That is what we mean by head and neck cancer. So to now answer your question, why is it a silent killer? It's a silent killer because, one, most of the symptoms that you tend to have with head and neck tends to be similar to symptoms that you have with other kinds of diseases. Like, for instance, now a patient that is having change of voice, we think maybe he just have small hoarseness of voice, or maybe because he's having something scratching him, and he will just say, okay, well, he will just be silent about it. It's subtle kind of symptoms, subtle that is not defined. Sometimes you just see some patients that say, okay, maybe it's just a swelling on their neck. So they won't really take it as anything. They'll just think maybe it's a kind of a swelling, it's an infection. Maybe they're having a nasal congestion, what we call nasal congestion, maybe in common language, catarrh. So you think that, and it has been there. So they will just see it as a common thing. And before you know it, that's the progress increased, and the mass of the disease now increase. So before you know it, become a silent killer that's at the early stage would have been treated, but now become late. So basically, that is the reason why it means said that it's a silent killer. The subtle symptoms that people don't normally will want to take care of at the early case.
Thank you for that. Okay, so based on what you're saying, because what I would have said is, what are the early signs and symptoms? Can you give us one by one what they are? Because, like for someone like me that lives with cancer, it's cancer. I always say to people, cancer doesn't give you warning, and cancer is an everyday sickness. So because I look at it from the perspective of being an everyday sickness, head and neck makes me ask the question, what exactly would therefore be the symptoms? Because you've said, you've given some examples, but are those the basic, are those the common, or are there general ones that we need to be aware of so we don't get ourselves in a...
Thank you, Dr. Dennis. So sometimes, even for us oncologists, we also wonder how that can, head and neck, if it's a breast cancer, maybe abdominal cancer, sorry, I'm digressing a little bit. You expect for that kind of a late presentation, but for head and neck that is obvious, everybody can see. So why are we having it late? Why do people present late? Which we'll see come to that. But the question is this. Some of these symptoms, which I will mention in terms of the early cases, are symptoms that occur with other diseases. Like, for instance, somebody that has what we call upper respiratory tract infection, we just have irritation, will be coughing, so he doesn't really take note of it. So other, like maybe bleeding from the nose, if I think, okay, maybe it's just a common, maybe due to hypertension, due to traumas. Those are the kind of early, but because all these early cases, they are similar to what we have with other kind of disease like infection. So what do we mean? What are the early symptoms a patient can present? Number one, it might not have any symptoms. They might not have any symptoms. But the early, we can, just like every other cancer, do not have any symptoms before you know it. The second one is that you might have a patient that will just come with a neck swelling, and that might just give it a neck swelling from the lymph nodes, might be a nasopharyngeal cancer. It might have a change of voice for maybe a laryngeal cancer, what we call the voice box. Just have a change. What we call it the hoarseness of voice, that the voice have changed for a long time. You just have that hoarseness of voice. You see that your voice is just changing, and it's just like cracking kind of coarse kind of voice. Sometimes you might have a patient bleeding from the nose. Of course, by the time the patient starts bleeding from the nose, we know it's to some extent. Sometimes you might have some swellings, abnormal swellings that you will not even, you will just look at it and see it can be swelling in the tongue, it can be swelling in around the mouth, it can be swelling around any part of your face. And so these are very common symptoms that are early, that we always advise that once you see your doctor, maybe your general practitioners, when they look at it, you should do an investigation to further determine what they are, so that it will be that at the late stage, they're presented at the late stage. So these are common symptoms. Like what I said, sometimes you have those symptoms, you don't even know that these symptoms, they are there. you are there. Like for instance, you have somebody that has a nasal congestion. Maybe for a long time he has been having this nasal congestion that has been there for chronic, and he will just be saying, okay, everything is fine. Let me take a nose drop. Let me take an antibiotics. And before you know it might just be a cancer around the nasal cavity, or a cancer what we call the paranasal sinus, that within the bones of the of the skull. So these are early symptoms that a patient can have with head and neck cancer.
Oh, wow. See, I'm not a medical doctor and I'm
Oh,
learning.
wow, thank you. That's really
So,
interesting, yes. Absolutely interesting. Thank you so much, Dr. Wagba. I gathered that, I like how you were pointing out to people that head and neck cancers can be tricky to detect, you know. You might already imagine someone who has had previous symptoms of catarrh, you know, it comes and it goes. They tend to mistake a lot of these symptoms and think it's part of an ongoing illness. So I'm guessing here that something people need to pay attention to will be how long these symptoms are lasting for, or if there are sudden changes. I think you also mentioned, if I'm correct, that a lot of times it's not sinister. So there might not be pain at the onset, and this I think also misleads a lot of people and lets them think it's nothing serious. Neck lump is not paining you, or maybe it's just a boy, maybe we just go away. So I'll just like to add that the absence of pain doesn't mean that this isn't sinister. And I'm sure our expert with me, you know. But while you respond to that, I would also like you to just quickly help us to understand what are the risk factors, Dr. Wagner? What are the things that make people susceptible to developing cancers of the head and neck, whether on the tongue, whether in the oropharynx, whether in the in the voice box, like you said? You know, what are these risk factors?
Okay, so thank you, Dr. B, for that question. And of course, thank God you use the word risk factors, because when we talk about the cause of cancer generally, we don't know the cause of cancer. And we won't say this is what we're going to point to, that say this is what is causing cancer. So what we use as oncology and as doctors is that we try to talk about the risk factors that, based on studies, have shown that when people tend to have these risk factors, maybe in terms of their lifestyle, in terms of the way they live, the area they live, what they expose themselves to, they tend to have this. This might be things that will make them have this head and neck cancer. First and foremost, one thing we should understand is head and neck cancer is it's a complex kind of cancer, because it's not just one cancer, like when you have it in the breast cancer, you have it like that, or maybe a stomach cancer or rectal cancer. A head and neck cancer is complex there because there's a lot of structures in the head and neck, and these structures on their own stand on their own, like what Dr. B was trying to point out in terms of you can have a nose cancer, you can have a nasopharyngeal cancer, you can have a oral, what we call the oropharyngeal cancer, the oral cavity cancer, we can have the void box or the laryngeal cancer, we can have the thyroid cancer, because that has also been added to, thyroid cancer is now is a cancer that they've been added to head and neck management now. So makes it a little bit complex. And if you look at the head and neck structure, or the way God has done the anatomy, they are very close to each other. So when we talk about the risk factors, we can now talk about in terms of, yes, we can talk in generalized risk factors for all of them, and we can now talk about specific risk factors for each of the anatomy. So, but I will first of all just talk about the general one for the head and neck, then maybe highlight some of them that are specific. One is the lifestyle. Of course, the lifestyle is very, very important. It has been noted that smoking is a really strong risk factor for head and neck cancer. Apart from that, alcohol intake has been noted to also people that are taking alcohol can also have that susceptible to have head and neck cancer. Now, when you now have the two coming together, effect of smoking and alcohol. It has been said that that can cause two increased fold of someone smoking and taking alcohol can have head and neck cancer. So the thing is that a lifestyle of smoking, drinking of alcohol makes the person susceptible to have any kind of head and neck cancer. The second one is, yes, we have some, although not common in this part of the world, in the Asian part, where they have what they call the beta nuts. Chewing of beta nuts is very common in the Asian and in the South Americans, where they have these beta nuts, has been noted to cause head and neck cancer. We have when you have the salty intakes of some of our food. Yes, I'm sure people will be afraid. There was salt intake, but that has also been implicated to cause head and neck cancers. Then again, when we now talk about the specific in terms of the type of cancers, we have some cancers that can be caused due to some infection like the viral infection. One of them is what we have, the human papilloma virus, is what the HPV. We call it, is a short form of HPV. It's called human papilloma virus. That's HPV, and is a type 16. Some type 18 has also been implicated, and they are implicated in what we call the oropharyngeal cancer. Also, just to note this, that the human papilloma virus, we have, there's a type that also causes cervical cancer. So it's almost the same thing. So we now have this HPV causing human papilloma virus, which is common with the Western world. For studies here in the Africa and in Nigeria, we're trying to still bring out studies for us to know how far we are with the virus. Another virus we have is what we call the Epstein-Barr virus. The Epstein-Barr virus has been noted to cause what we call the nasopharyngeal cancer. A nasopharyngeal cancer, like what we say, is a cancer that arises just behind the nose, in front of the ear, and that is like is a space in front of the ear behind the nose, and cancer can arise from there. So it's been noted that Epstein-Barr virus, what we call the EBV, can also cause lead to a nasopharyngeal cancer. So we have a variety. Genetic is not that genetic has not been noted, but of course we can still have some genetic exposure to radiation also has also been implicated. Thank you.
Thank you, Dr. Wagba. Thank you so much. Dennis.
Yeah, let's take a quick break now, and we'll be back in a few minutes to continue. And thank you all. Stay with us, please, and we'll see you soon. Welcome back. Thank you for staying with us. Let's continue this conversation with Dr. Wagba as we finish up on this head and neck cancer topic. And I've got a question for you. So how does late diagnosis affect survival rates? And based on what you're saying to us now, it's quite important that we remember it is very key. So can you go and why do so many Nigerians get diagnosed late? And I think you've actually covered that a lot.
Okay, thank you, Dr. Dennis. It's so sad, and of course, every one of us, especially when you're living in this part of the world, you would know that most of all our cancer cases, Dr. B will bear witness, because I know he also deals a lot with that and he sees them every day. Is that most of our cases that we see, they present late, and we've tried to mention one or two reasons why they present late. And I think it's generally for most of all our cancers that they present late. Ditto cancer. Like what I said before, one will be surprised to see that something that is so obvious that you will see in your face that is glaring, you're looking at your mirror every day, the next thing that people come very late. So early presentation of cases, we can guarantee or achieve what we call cure. Late presentation, of course, just like in every cancers, they present late. When they present late, curative intent is out of it. Then you begin to ask yourself, why are this patient present late? Some might be because they are ignorant of it. Some might be the fact that maybe financial constraint, because of the part of the world what we have is a lot of financial constraint.
Absolutely.
Some might be in the sense of the facility. Yes, because if you're looking at this part of our world in Nigeria, yes, the government is trying, some of the private sectors are trying, but the truth is that the facility is not enough. Because the truth is, when you come to the treatment of cancer, of head and neck cancer, it's not just that you are giving chemo. Radiotherapy is like, after surgery, radiotherapy is like the second. So most times we even have radiotherapy coming first. And radiotherapy, if you're talking about, is the facility that we know one person cannot just get unless that person is really a billionaire or the person has that heart. But most times it's still government, and we give it to government is trying. So you see, what we are also facing is that sometimes when this patient go and they meet with the GPs, the general practitioners, and they talk to them, they tend to take a long time, maybe for diagnosis, maybe we don't just know, but they waste a lot of the patient's time, and you see that the cancer keep growing. Maybe the factor of financial constraint is also there. So you see our patients coming in late, and at the end of the day, it's got that giving them that best treatment to achieve cure is not, it's something far from us.
Wow, Dr. Wagba, thank you. That's very insightful. I'm hoping that maybe as we hear this, people will be more inclined towards quickly going to get medical care for whatever symptoms is persisting, because it could be cancer and you need to just move faster. And if you feel like your time is being wasted while you're with one setting or one physician, perhaps getting a second opinion as quickly as you can might be the life-saving step. You'll please quickly answer for me in a few. Are the treatment options available? Do people get well when they are treated for head and neck cancers? Is there something to give us hope? That what we have locally can be compared to treatments globally. Just wrap this up for me and let's move on. Thank you, Dr. Wagwa.
Thank you, Dr. B. Just to list it, of course, I can say it confidently now, both in terms of the surgery, which is one of the treatments, radiotherapy, other types of usage of drugs, in terms of injection, what we call immunotherapy, targeted therapy. They are all available in Nigeria, and they are all available. Yes, you might say they're expensive, but they are all available. And we can say by fact that when a patient presents early with most of all the head and neck cancer, we can achieve cure today in Lagos, in the north, in the east. We have the machines, we have the radiotherapy to treat. So to list out the treatments, we have surgery, where we have the oral maxillofacial surgeons and what we call the ENT surgeons. We have radiotherapy, which is what we do to treat cancer. Then we have the chemotherapies. Then we have the immunotherapy and targeted therapy, which are available, and they are very, very much available in the country.
Perhaps affordability will be another issue that we would like to delve into. But Dennis, I'm sure you have something to ask our guest today.
I think as we are rounding up now, I'm going to ask you to give me one sentence, please. One sentence so we can close. And that sentence is, what message do you have for Nigerians watching right now, especially those who may be afraid or unsure about seeking help? One sentence as we round up.
Please, one statement I'll make is, see your doctor if you have any of the symptoms. If you're having any abnormal swelling, if you're having any bleeding, if you're having any pain, try and see your doctor. Look at your face in the mirror every day. If you see any changes, please visit your doctor, because early presentation, you can have cure.
Thank you very much. It's been very nice listening and talking to you. I think we will be saying a big thank you. Dr. B.
Yes, Dennis. Thank you, Dr. Wagba. Thank you, everyone, for following us on this topic today. Kindly share and let other people see these videos so that they can be helped. If there's one message we hope stays with you after this presentation, it's that head and neck may be silent, but together we will speak louder, we will educate louder, and we will fight louder so that everyone can get a chance to fight. In the face of fear, ignorance, and delay, our voices are the difference between life and death and loss. So please, let's make sure that we're speaking up every day. Thank you.
So too many lives have been lost simply because they didn't know the signs or didn't know where to turn. But you now know. So with that knowledge comes power. The power to ask questions, the power to seek help, the power to save a life, maybe even your own. I live with cancer. I can tell you, please do the right thing. And as we round up,
Okay then, so please, we're challenging you. Please don't keep this conversation to yourself. Talk about it, share it, pass it on, and follow the Common Cancer Foundation, please, so that you can get more information. Because together we fight, and together we win. Common Cancer Foundation is this video. We're hoping that you will go on and share it. Thank you, everybody, and our big thanks to Plus TV Africa for hosting this program.
and thank you as for staying with us and sharing with us. We really appreciate you. Have a fantastic week, everyone, and see you again next week. Have a lovely week.
Bye. Thank you.